River is a big miracle for our family. When I was pregnant with River, COVID was going crazy. The numbers were increasing. When I started having symptoms, I got swabbed. The minute the doctor found out my result and it was positive for COVID, they reached out to me, informed me that I needed to monitor my oxygen saturation level. So on November 25th, that night, I was feeling really bad. My oxygen level was under 90, and I told my husband to take me to the ER.
There was a team that decided that it was in their best interest for them to do an emergency C-section to help Linda's body not have to work as hard.
I had requested to keep me awake if I was healthy enough, because this is my first, pregnancy experience. Even just to get a glimpse of him before he was transferred to the NICU, because at that time I knew I wasn't able to hold him and do skin to skin with him because of my positive COVID. I was actually awake to see him get delivered.
After the C-section was done, Linda's body still didn't recover in the way the physicians had hoped, and a decision to put her on respiratory ECMO was put into place.
ECMO is the last-ditch effort to do because you're completely bypassing the lungs. A patient can be doing poorly for weeks, and all of a sudden they just change, and it's like, wow, they're finally doing better.
Honestly, I thought I was gonna lose Linda, and I was gonna be a single father.
I remember the day she started getting better. I was able to call Sam. I was able to FaceTime with him and say, Sam, I finally have good news for you. And it gives me chills still thinking about it, just because he was so excited.
I woke up and my body was very weak. I wasn't able to move my legs. I wasn't able to move my arms.
I would set up goals with Linda. So using our whiteboard, I would say, okay, Linda, I know we sat up in the chair for an hour yesterday, so today we're gonna do 2 hours, and we're gonna get out of the room. I wanna see you move your feet around. I wanna see you bend your knees every 1 to 2 hours.
Those goals will set me one step closer to River.
As we started seeing improvement with Linda, we knew she needed to see her baby. So I was able to work with the director and the supervisor to get them here. She was able to hold her baby for the first time and truly form a bond that she so desperately needed.
It reminded me what I needed to do, and not to give up. I've gone this far, and all these other doctors and nurses did everything in their power to save my life, and I was really given a second chance to live. We've waited so long for him, and I'm gonna have that chance to see him grow up. And so holding him really reminded me that I need to be strong.
It was so exciting just seeing that the work that we did with all the interdisciplinary staff, with Linda's goals and the family's goals and the nurses and physicians and the respiratory therapists and social work, all of that team that worked so hard was able to say goodbye. And it was a glimmer of hope. That's exactly what this hospital needed.
Every day I would tell them, okay, so tomorrow, do you think I would be able to walk without my walker? Do you think I'd be able to stand without my walker? And they say, oh, maybe a couple more days, But they knew what my goals were. They asked me about my home setting and what are the main goals that I was wanting to accomplish. And the minute I stepped in the door, I just felt this sign of relief that I made it this far, that I'm actually home. I sat down, my husband grabbed the baby, and that smile was everything. It was the best moment. It was just like, oh my gosh. Every time we hold him and he's asleep, and we just can't believe we made him. Like, he's our baby. We're just lucky to have him in our life.